Ottawa. Hi again, Ray Watt.
Hi, how are you?
Doing okay. So Ottawa broke its coronavirus wastewater levels 6 days in a row this week. Do you agree, Minister Elliott, that there is no cause for panic? Do you agree with that assessment?
Well, there's never any cause for panic. The question is, how prepared are we to absorb the challenges to the healthcare system that are upon us? We probably are in a pretty good place. We have some good capacity in the healthcare system, but we do have a crisis in healthcare workers, and we have a crisis in runaway infection rates. So I think there's a reason for the planners to be concerned and maybe to reconsider some of the decisions around removing pandemic restrictions. But individual citizens should not panic. We should be prepared to make certain choices as the days come.
Okay, prepared for things like what?
Well, I think we're going to talk about fourth doses. Prepared to consider getting a third or fourth dose. Prepared to wear masks again in indoor settings. Prepared to minimize your exposures if you can.
So, okay, we'll talk about minimizing exposures in just a moment. But the fourth dose, for instance, if we already haven't seen as high an uptake of the third dose, does the fourth dose really help?
It's a good question. Now, it matters who we're targeting it to. So right now, NACI is advising that those over 80 get the fourth dose, and Ontario is suggesting those over 60 get it. The uptake for those over 80 of third doses is extremely good. In fact, those over 80 have the highest vaccine coverage for the first booster shot. I think 83% of adults over 70 have the third dose. So I have every expectation that that demographic will get their fourth dose. The question is, will anyone else? We have in this country only 47% of the population has had 3 doses. Ottawa is like 54%. So we have low uptake in general. But for those who really need it, I think the uptake will be quite good.
The uptake in terms of people doing it, in terms of the difference it would make?
Uptake in terms of people who are eager to get that fourth dose. Now, what kind of impact will that have on the insult for the healthcare system? I think it would be pretty good, given that those over 80 are the ones who are most likely to get seriously sick, hospitalized, and die. So it's important that we protect them. But it's also important that we maximize reduction in transmission to protect the unvaccinated, in particular those under 5. We have an increase in pediatric hospitalizations in this province as well. So I'm hoping more people choose to get that third dose than currently do, and those who are eligible will choose to get a fourth dose.
Okay, talk to me about the minimizing contact in terms of how that could happen, should happen, in your opinion.
I don't want to disparage any businesses. If people are going to restaurants and bars, I mean, it's great for keep those businesses up and running. I think, especially if you've got an immunocompromised or vulnerable person in your life, you should be choosing to reduce the number of people that you see on a weekly basis. I have a child under 5 who can't be vaccinated, therefore I see nobody, because to my mind it's not worth the risk of exposing that child to indirect infection. So we have to make good choices as individuals, especially given that the government has said that now it's up to the individuals to manage this pandemic. The state is sort of keeping their hands off of it.
So, do you think that if we're at a sixth wave, if we're heading into that next wave of whatever mutation or shift the virus is going to go through, do you need to see the government stepping back in?
First of all, I think we're in a sixth wave already, and we're probably going to peak sometime early in May, and so we'll back down to something manageable by the end of May. I would like to see the government take a more forward position, yes. I would like to see an active advocacy for third doses and for fourth doses eventually. I'd like to see a high recommendation for masking. If you're not going to return the mandate, I don't think the government is in a mood to return the mandate. At least be advocating strongly for people to voluntarily take up the masking again. And I think the kinds of things the government can do that have a high impact in terms of policies are requiring paid sick days. Symptom checks are an easy way to keep likely transmissible people out of indoor settings. That should be normalized. And to maximize the distribution of rapid tests again, to make sure that people have the tools to manage. Because if we're going to do this on an individual basis, individuals managing the pandemic, we need the tools to do so.
Sorry, symptom check meaning what exactly? Mm-hmm. That a business would be checking for symptoms of people who are coming into it or employees?
I think we should be discouraging symptomatic people from coming to work and coming to school and not penalizing them for doing so. So you don't lose a day of work, for example. And so if you can keep a child with sniffles or coughing out of the school, you have a higher chance of reducing the likelihood of a spreading event taking place. So what that would look like, I'm not sure. But having in your HR policies that we will support people who are symptomatic and who can therefore stay at home until their symptoms abate.
Is there a chance of herd immunity at this stage? I keep hearing people bounce this idea around.
Well, look at California. There is some suggestion that they've achieved some kind of temporary herd immunity because of their high infection rates. Omicron infection does not seem to offer lasting immunity, but there's some temporary immunity possible. So you can probably get something resembling herd immunity lasting a few weeks or months. Kind of like you do with the flu, kind of. If enough people get the flu and are vaccinated, then you've got population immunity lasting a few months until the end of the season, sometimes, maybe. But it all comes down to how transmissible this virus is and how lasting the immunity is, either through vaccination or infection. Right now, we don't really know the answers to each one of those questions, so it's hard to answer it.
So what are you going to be watching for in the days ahead, Raywatt?
I'll be watching the hospitalization rates, especially amongst children, those under 5. If we're failing the children, we fail as a society. So I'm hoping that we're all making good choices, that the government is watching as well, and is willing to step in if those numbers start being concerning.
Raywatt Deyanandan, thanks very much for being with us today.
Thank you very much.